welcome to the PT on Ice Daily Show. It is the greatest day of the week here on the podcast. It is Fitness Athlete Friday, and I'm your host, Dr. Zach Long. I'm one of the lead faculty members inside of our Fitness Athlete division, and I'm excited to chat a little bit today about CrossFit injuries, something that we have all heard a lot about. And I just want to go through a little bit of the research of what we actually know related to injury incidents and where injuries occur and why injuries occur in the CrossFit athlete. Before we dive into that, let's mention a couple courses that are coming up. So it's the end of the year. We're kind of wrapping up between the holidays. We don't have any or many live courses coming up over the next few weeks, but we start hitting the ground running in 2022 pretty quickly here. So Modern Management of the Older Adult has 3 courses coming up in January. So in January 8th, they'll be in Fenton, Michigan at Health HQ. January 15th, they're going to be in Hendersonville, Tennessee. And January 22nd, they will be in Pennsylvania. Our extremity course, January 15th, will be in Atlanta, Georgia. And then lumbar spine management, January 22nd in Greenville, South Carolina. So a lot of opportunities to catch ice on the road in early 2022, and we look forward to seeing you there. So let's dive into today's topics of injuries in CrossFit, what the research says, and what are the key takeaways that we as rehab professionals should gather from this research. And let's kind of start with the obvious one, the thing that people tend to talk about way too much at this point in time, and that's the overall injury rates that occur in CrossFit, which this has been studied multiple times. So a lot of different studies have looked at this, and most of them are going to find relatively low injury incidence, which is very different than what so many people in the medical and fitness world say, where they talk about how dangerous CrossFit is, etc. Well, the research is pretty conclusive at this point with the number of studies out there that the overall incidence of injury is relatively low and comparable to other recreational fitness activities such as powerlifting, Olympic lifting, running, etc. So most research studies that have looked at this find an injury incidence between 0.8 and 3.1 injuries per 1,000 training hours. That's where the bulk of these studies have found the injury incidence rate to be. So that, again, is relatively low. Injuries are typically reported in sports in terms of how many injuries we see per 1,000 training hours. So very, very low, on par with other similar exercise activities that people don't seem to scoff at near as much as they do CrossFit. And I think it's also important to note when we talk about these injuries, even those research studies themselves will mention that the injuries that happen are relatively minor. We're not talking about people like fracturing their spine and needing repeated surgeries, although that certainly does happen at times, but most of the studies are going to say that these are minor injuries. We're talking about patellofemoral pain syndrome. We're talking about rotator cuff tendinopathy, etc. Things that we know as medical providers, those should be like our home runs. And somebody comes in with patellofemoral pain, somebody comes in with rotator cuff related pain, and they're following an active lifestyle like CrossFitters are, we should know that those are going to be fairly easy things for us to help clean up really, really quickly. So we don't need to focus so much on the overall injury rates in CrossFit because the research is just pretty clear at this point that that's not something that we need to overall worry on. But we can break that down a little bit more and learn a few other things about CrossFit injuries that the research has found. One thing that's really important to look at in terms of reducing the number of injuries, the research has shown that when we have better coaching to student ratios, when there are less students per coach in a CrossFit class, we tend to see a pretty big reduction in injuries. So when you're looking for a CrossFit gym to join, or you're looking, you have a patient that's asking you about, what CrossFit gym should I be looking at going to? One of the big factors that you should consider in that is what the class sizes are. If you know CrossFit A down the road has 25 students for every coach in every class, you know that that's not going to probably be as good as CrossFit B down the road that has 12 to 15 students per coach. And really what that means is when there's a lot of students to little coaches, the coach's ability to give individualized feedback during the workout is reduced. The coach's time that they have before the class to go around to each member and make sure they have the appropriate weight on the bar, or that they're doing the appropriate scale of that gymnastics movement gets kind of lost. And when people aren't doing the appropriate scale or version of that workout for where they are fitness-wise, that's where we at times see things get overloaded. So really pay attention to the coaching to student ratios. Another thing that we've seen in the research is that novices actually tend to get injured a little bit more than experienced CrossFitters. So if somebody's new, they're at a higher incidence of injury. So one research study found 9.5 injuries per 1,000 training hours. But what was really fascinating about that was when they went back and they took those athletes that got injured and they linked any of those injuries to a previous injury, they saw injury incidence drastically reduced to being back between that 0.8 to 3.1 that we talked about earlier. So as we all know, the biggest risk factor for an injury is a previous injury. And so this is a really good spot for us to come alongside somebody and really help them out. If we have a good relationship with a gym, this is how we help them out. If we're referring one of our members to the gym and we know that that person has a history of some shoulder instability, then we need to be dialed in as a profession at taking somebody with shoulder instability and talking them through the right progressions of getting to some of the gymnastics movements and some of the Olympic lifting movements that CrossFit athletes are going to see. And we need to get ahead of those issues. That doesn't mean that we tell them that they're not going to ever do kipping pull-ups or they shouldn't do squat snatches, but we need to educate them and work with their coaches on understanding what progressions of things would be best suited for that individual, or write them a little bit of accessory strength work to stay ahead and further bulletproof that area against that slightly increased incidence of injury. So that's a really important thing that we need to consider. Or if we have a really good relationship with the gym and a gym's doing a really good job of screening new members where they're going through like a readiness for physical activity questionnaire and they're getting that injury history and they found out that this new person showing up at the gym has a history of multiple shoulder dislocations, then that's great that you have that relationship because that gym might go ahead and send them to you beforehand to go ahead and start doing some of that accessory work for them. But that all comes down to our understanding of these movements, because if we're just a standard rehab professional that knows TheraBand exercises, knows how to coach mini squats, but doesn't understand the intricacies of the movements performed in CrossFit, then we're not going to be able to bridge that gap for these individuals. So that's where it's really important for us to have a really good knowledge of what CrossFitters do. The next thing we know from the CrossFit injury research is where injuries tend to occur most frequently. And in the research studies that have looked at this, there are three things that always pop up as numbers 1, 2, and 3. And that's shoulder, number 1, back, number 2, and then the knees. So why do we see these three areas kind of pop up a lot? Well, they're the areas that get stressed a little bit more in CrossFit than we do see in other recreational fitness activities. So for example, the shoulder. The shoulder joint sees a lot more dynamic loading in CrossFit and a lot more full range of motion loading than we see in most recreational fitness activities. So if somebody goes to the gym working on their overall strength and conditioning, they're doing bench press, so their shoulder goes through maybe half of its extension range of motion, and they're doing lat pull downs, which don't challenge shoulder range of motion beyond like 160 degrees of flexion. So they see a good bit of range of motion, but in CrossFit, we then take that to dips, which takes the shoulder to in-range shoulder extension. We then go into the kipping pull-up and the snatch, which takes our shoulder into in-range shoulder flexion. So we see a little bit more dynamic loading on the shoulder. We see a little bit more range of motion challenges on the shoulder. So that's probably why we see shoulder pop up number 1 on that list. Again, highlighting the importance of us as medical professionals. If we want to work with this population, we have to be able to dial in those movements and break those movements down. So we're going to see a lot of rotator cuff related shoulder pain, shoulder instability, and stiffness dominated shoulder pain in this population. And our ability to regress and progress these movements that CrossFit athletes do are incredibly important when it comes to shoulder pain. Second most injured area that we see with CrossFitters is going to be the back, which more times than not, I basically end up classifying this as flexion intolerant versus extension intolerant low back pain in the CrossFit athlete. And then us as physical therapists with this population, we have got to be really good at modifying their squats, their deadlifts, their Olympic lifts in order to, number 1, keep them in the gym and working on their fitness because they care about that so much and they're so driven to stay fit. But number 2, how do we also change their technique a little bit so that long term they're able to perform these movements a little bit more without getting these symptoms? We need to be able to identify strength imbalances or programming issues that happen with that individual's programming that they're following that may have led to that overloading in the back happening in the first place. And then the third thing that we commonly see is knee-related pain in the CrossFit athlete, which always ends up being, minor cases of patellofemoral pain syndrome versus tendinopathies versus intra-articular derangement there. And our ability to screen out those different things, progress, regress, modify, is what really separates average physical therapists from great ones when it comes to this population. Two other things that we really know related to CrossFit injuries, according to the research, is at what movements do these happen in? So more injuries than anything else happen in the powerlifting movements of CrossFit. Your bench, your squat, your deadlift, and variations of those movements. That's number one. Number two is your gymnastic movements. Your push-ups, your handstand push-ups, your dips, your pull-ups, your muscle-ups, etc. That tends to be number two. I was pretty surprised to see that as number two because, if you talk to people about CrossFit and what their problems are, they always talk about the kipping pull-up and the dynamic gymnastic movements that CrossFitters do. And so to me, it was pretty cool to see that was not the number one area of injuries in terms of movement patterns, that it's powerlifting, not what most people think it is. So maybe those movements aren't as dangerous as some people that are a little behind the times on that think that they are. Number three, in terms of where movements happen injury-wise, it's the Olympic lifts. Your clean, your snatch, your split jerks, push jerks, and those different variations of that. So important to know. If you're treating CrossFit athletes, you have to know the powerlifting movements, you have to know the gymnastics movements, and you need to know the Olympic lifting movements in depth. The final thing that we do know from kind of the CrossFit injury research is that there's kind of a sweet spot in individuals' training. So it's the number of days per week that they train. When individuals train less than 3 days per week or more than 6 days per week following CrossFit style training, that's when we tend to see injury risk go up and injury rates go up. So we really want to be in that sweet spot of training 3 to 6 days per week, which follows the typical CrossFit model of 2 on 1 off or 5 on 2 off tends to be the best. What we tend to see is if you're training 7 days a week, you're not giving your body that little bit of rest time to recover and be ready to get after it again. If you're training less than that, those athletes aren't being exposed enough to the varied movements that they're going to see in CrossFit. So, if they only show up twice a week, maybe they're only seeing a deadlift variation every 2 or 3 months because they're missing so many workouts. Maybe they're only seeing kipping pull-ups every 2 months. And so they don't learn the movement patterns at the depth that they should, and they end up getting thrown into some high volume workouts at times when they haven't built up that tissue capacity just because they're not in there quite frequently enough. So I hope that gives you a lot of things to think about in terms of the CrossFit athlete and their specific needs and what the injury or the research says related to injury rates, where they happen and why they happen. If you know that this is a hole in your game and you want to improve your ability to work with these athletes, you got to jump into the clinical management of the fitness athlete courses. So we have our essential foundations and advanced concepts online and our live course as well. When you finish those 3 courses, plus then looking at our pregnancy and postpartum courses, your ability to really help these athletes out and come alongside of a gym and change the healthcare landscape in your neighborhood is going to be drastically improved, and you're going to have a blast treating these patients that are also super motivated to get better. So check out clinical management of the fitness athlete courses online at ptonice.com. I hope you all have a fantastic weekend and look forward to seeing you next time here on the podcast.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.